Good morning, everybody. It's Joshua Paul, president of Neocode Software, and we're here today to have a look at Sarah Dimick's webinar on her poster and her attendance at this year's Casper conference in Montreal. I'm really looking forward to hearing what she has to say, and over to you, Sarah.
Thanks so much, Josh. So yeah, I'm happy to be able to share this research. This is based on research that we completed last winter, and it's exciting that it's getting some more traction now and getting shared a little more widely now. So I was able to attend last week's Casper conference, which was a wonderful conference full of all kinds of diverse perspectives on Canadian healthcare and where it's going. And I was able to share this research there, and I'm sharing it again here for you today. And so here we go. If I can move the slide forward, there we go. So just a little bit about myself and the research. This research, digital technology adoption for BC's health system, was sponsored by Neocode, and so thank you to Neocode for that. But it was also really important that we had support from a number of different people. So we had support from Pablo Ramirez at the PHSA IMITS Center for Innovation, Validation, and Collaboration, and that was critical for us and our success here. We as well had great survey respondents. We had 65 survey responses and 23 interviews with healthcare providers across BC in various different roles, anything from researcher to physician to nurse practitioner to medical administrator. So we got a wide variety of perspectives that really made this rich research. Finally, I have special thanks that I need to give to my two external reviewers, Gabriela Prada and Tamara Forte, who went through the research carefully with a fine-tooth comb and helped me make it even better. So thank you to everyone involved. And this is just a quick outline for our presentation today. I'll be going through a bit of the background and the research that we did, identifying both the barriers and the pathways that we identified to digital technology adoption, as well as sort of the background on why would we bother to look at digital technology adoption in the first place. And before we get to the conclusions, I have some key learnings that I took away from the Casper conference last week to add in there as well. That's me at the conference. There you go. So this is the one slide. If you only could print one slide from this whole presentation that you wanted to know what the research was about, this is the one. So this is the key takeaways from the research that we did. And basically what it says is technology and adopting digital technology successfully can greatly improve systems, productivity, and innovation. This is true across sectors. This is particularly true in healthcare. Productivity in healthcare improves competitiveness. I know competitiveness can be a tricky word when we're talking about healthcare, but it's a really important one because Canada is lagging in terms of our competitiveness and our productivity there, and we need to have better competitiveness, better value for money to support our citizens and our healthcare providers. Also, for healthcare, digital technology is not a means and an end in of itself, but is a means of improving the quality of healthcare, the health of populations, and the efficiency of healthcare systems. And I really want to draw attention here to the fact that it's also critically important for healthcare providers themselves who are experiencing burnout at fairly alarming rates. If they have simpler, more straightforward ways of doing things, then they will have more success and fewer burnouts. Finally, to bring it back into the BC specific context, we identified that there's really significant investment and direction from BC healthcare system towards being more productive, towards being more innovative, and towards adopting digital technology specifically. However, that's not trickling down to the people who are on the front lines interacting with patients and trying to adopt digital technologies. So there's a bit of a disconnect there, and that's part of the barriers that we'll explore. So this is that we're lagging picture. This is the really startling Canada's 9th here in a group of 11 comparator countries in terms of our health system performance ranking. Just as a side note, I was really pleased to see that this was research that was cited a number of different places last week. So it's clear that we're all honing in on the same lessons and the same need for improved competitiveness in the Canadian healthcare system. In addition to this statistic, I should also bring up that Canada currently ranks 30th in the world according to the WHO for our healthcare system, which is pretty low considering where we think we should be. And Canadians are not getting the value for money. So in 2014, the statistic was about 10% of our GDP was being spent on healthcare, and that's only gone up. It's about 11.5% currently. So we need to get more for what we're paying in. So digital technology, why digital technology? What does digital technology have to do to productivity? And what is this silly thing called innovation? So this is digital technology is a number of different things, but we really are looking predominantly at ICT. So digital technology has been proven through literature reviews that we've seen around the world to improve productivity. When digital technology is successfully adopted, it improves productivity for the users. So since we know that, and we know Canadian productivity in healthcare is lacking, it's common sense, and it's something that is being seen across the board, that digital technology can improve productivity. I have got this ranking here of ICT investment. ICT is an investment is a frequent indicator that we use to measure the innovativeness of countries. And so, for instance, the Conference Board of Canada is currently ranking Canada at 12 out of 16 peer countries for our innovativeness, and giving us the grade level of a C. And that's just brand new information out of the Conference Board. It's been ranked C or D for the last number of years. But it's really important to be more innovative, because innovation and adopting digital technologies, it all works hand in hand, and it's the idea of doing something new that has value. In healthcare, it can be even a little more specific, and it should not be confused with invention. But it is about creating activities that are defined more by intent and the creation of a new process or economic or social value. So these are powerful tools, and when they're used appropriately, they can be really impressive. So if we look towards BC in particular, I know you're probably more familiar with BC than I even am, but there are a couple key things that we want to pull out here. The first one is that there's leadership that's pointing towards adopting digital technology as being really important. The Ministry of Health and the PHSA both have in their mandates, in their leadership documents, their strategy documents, goal setting around productivity, around innovation, and around adopting digital technology. This is a clear goal, top-down goal for the organizations. So given that, people are feeling, we were getting quotes like the one that I've got up here, that the word innovation is being pushed, but the pathways towards it are not always clear. So this is a key challenge. The chart here shows responses from our survey, and it's this declining line that we really need to be aware of. People are taking the time to assess their workflow processes, but then they have less time to share those lessons that they're learning. So they're gathering knowledge. They're starting to know what we really need to do better. They have fewer and fewer hours to spend really sharing that knowledge with others and making these lessons applicable. And then finally, even fewer, only 35% feel they have the tools they need to address productivity needs and process needs. So the direction is there, the vision is there, and you know, there's been a huge investment in the CST, $842 million at last count, towards adopting a giant digital technology for the entire province. I know it's not without problems, but the goals and the leadership is trying. You can see that it's very clearly working towards adopting these digital technologies and moving productivity in BC. So we just talked about sharing. Sharing is so important, and this is just a couple slides here to make it real. So what are we really talking about, and what is really the point? These are all little quotes from our survey respondents on what happens when digital technology goes right. But just to give you a sense, the digital technology adoption process was described as anything from painful to seamless. And so there's a huge range. And what we're going for, obviously, is that seamless end of the spectrum there. But I'll just read out a couple of these wins. So when digital technology is adopted, it can improve productivity by saving time and ensuring more time to spend with patients prior to the procedure and to answer questions, providing better services for our clients and their families, securing significant improvements in time management and contacts within the unit, and finally to help save time and measure standards of practice. So those are all wins that have been enabled by the adoption of digital technology. And then if we go to our next slide there are those actual 3 cases that we went through in our report that really highlight different stages of digital technology adoption and just how successful it can be. So that number 1 there is a peer-to-peer iPad-based test for speech language pathologists and psychologists. So this is being adopted in BC Children's Hospital, and it's made a transition. The language testers there have made a transition from paper-based to iPad-based testing, and that's enabled them to create standardized tests, to share their test results instantly, and really has saved time, money, and space. So now they're not even storing paper exams. It's all considered to be a huge win there, and that's something that's been implemented. A very simple technology, very easy to use, but it's a big win. So it's worth commenting on. The second one there is one more we want to talk about the success of the approach here, because this hasn't been completed yet, but it is underway. The Sunny Hill Health Center is looking at adopting some new technology that will enable them to customize scanning and carving new cushions for optimal physical support. So they work with a lot of clients who have very specific needs, and so they're looking at 3D scanner systems to both scan the body and then carve cushions to match that body perfectly. This is a big process. It's a huge investment, and it will be a big technology when they do adopt it. But the thing we want to really highlight here is the current and consistent engagement with the team members, with the people who will be using the technology. They're part of the process. They're part of the decision-making process, and they're part of the needs-gathering process. And because they're so engaged now, when it actually is adopted, they will be fully using it, which is a huge win. Finally, the FileMaker for BC Women's Hospital Health Center. This is a big win because just because of the challenge with the implementation. When we spoke to Caitlin Johnson, she said the technology there in itself was the easy part of the equation. It was her challenge in making her team's data work across 5 different health authorities, and she's done that with the successful adoption of the FileMaker there. So those are 3 real-life, actual cases that really exemplify what we're talking about. But they've all had challenges. So here are the 8 barriers that we're going to be talking about. And this is a high-level slide, but I just want to draw your attention to the fact that we've made this scatter on the right side there, and you can see that all of the barriers we've identified fall into the complex problem. We're not saying any of these are easy things to fix. They're all complex, but they're varying degrees of complex, and some are short-term, so they're easier fixes. But we'll go through the barriers now. So the first one we've identified is privacy and legislation policies. I'm sure this comes as a surprise to no one. I like this quote here, that privacy has taken on a life of its own and is holding up and blocking efficiencies. When we went through this, we found 5 specific different ways that privacy is becoming a problem, but the ones I really want to draw your attention to are this just fear of sharing information. There's such a risk-averse culture, and privacy is so important. And no one in the field has said that it wasn't important. All of the practitioners that we spoke to agreed that privacy keeping privacy is hugely paramount. But it works as an easy way to say no. And so if you don't want to change, if you're risk averse, if any change may open a risk, you just throw out that privacy flag and it's an easy no. So that's the first barrier there. The second one is IT system constraints and limitations to interoperability. And this is more technical, but the big thing I wanted to just flag here is that a lot of the people we spoke to had trouble with, sorry, I'm just going to move this there. Now I can see what it says. With their connectivity or with their IT systems being able to adapt. They just weren't up to date. They were still using programs that were quite old and working on adopting, you know, the next generation for them, which is 4 or 5 generations behind industry standard. The other thing with IT systems that's really important is there are a number of people in the population in BC who are in remote and not in remote locations, and connectivity there is the foundation for the services that are being provided to them, and it's a huge challenge, so that's another issue. There we go. Moving on, we'll talk about these 2 twin constraints, always together, are funding and time. So this is really, these are more short-term. These are dependent entirely on administration and redirection of finances, but they're difficult because any time or energy that is spent off your day-to-day tasks, assessing the challenges, learning about useful technologies, doing the research and the work that's needed to actually adopt a new digital technology successfully is time and money that is not spent on the day-to-day work. And we know healthcare providers are busy. They are working nonstop all day, every day. So taking the time, taking the money away from that daily practice is a huge challenge for them and needs to be carved out from their leadership. Next, we're looking at organizational culture and top-down versus bottom-up. So again, organizational culture, it ties back to a lot of the things that we've talked about before, but really stressing the fact that this is a risk-averse culture and very resistant to change. That's key here, and also highly bureaucratic, highly political. So there's a lot of hoops and challenges within the culture when people are looking to bring in change. Another culture point to mention here is that we really identified that these are a lot of people who are very autonomous in their roles. So if a new technology is pushed from the top, which is that next point, the top down versus bottom up, if a new technology is announced and expected to be adopted, if it doesn't work for the practitioners, it will be ignored. And we saw that through our interviews, we saw that through a web survey, and just anecdotally, people are not using the things that don't work for them. And if it's not intuitive, if they don't have the support they need, they're simply not going to use it. So our final 2 barriers here are the silos of excellence and a lack of awareness and understanding. In terms of silos of excellence, this was really an excellent point that a number of our interviewees brought out. Canada in general, and BC in particular in this case, is really good at innovating and creating unique small pilot programs that are innovative and exciting and really represent what can be done large scale. Our big challenge is spreading that excellence beyond the pilot project, and that's where we fall down. So I like the quote here that we have from one of our participants who said, "We have ghettos of excellence where we ghettoize all the cool and innovative kinds of activities." It's a huge challenge. And it's not just a healthcare related challenge, but it is a huge challenge within healthcare. The lack of awareness, this goes back to that time piece. If the administration and the practitioners themselves don't have the time to do the research to find out what's available, they simply won't know what to work for, what to ask for, what to plan for. And so if something's not intuitive, they don't spend a lot of time and energy making it work. There's just so much on their plates that it's not going to happen. So that hole there is a bit of a challenge. All right, now we'll move on. I want to make sure that we leave you with a positive note here. So we'll move on to the pathways towards digital technology adoption. And we've identified 6 key pathways. And just as a note here, these are all things that we've focused on making relatable and usable for the people who are on the ground and looking to adopt digital technologies within their own practices, within their own working groups. So this is really directed not at a systems level, but at a working group level. So the first one we have here is about building your business case. And we've identified three key ingredients to build a really strong, solid business case, because we know that you need to build a business case in order to get the approval, to spend the money, to spend the time to adopt a new digital technology. So these three ingredients are cost savings, having clear technology descriptions and demonstrations. That goes again back to that lack of awareness, right? Making sure that people understand what you really want and why you want it. And then having powerful partners, both within your institution, people who can help shepherd and sponsor your digital technology along, as well as outside. The next piece there is the process review and implementation. The process of keeping your processes simple and following through is really important. As the FileMaker process that we showed in the last couple slides was, the technology is the easy part of the equation, but you want to make sure that the technology is being adopted to do something in the most streamlined and effective way possible. So that's point number 2 there. The third one is to enlist champions. And from wherever you can in your organization. They may be within your working group, they may be someone who has gone through the process before in a different group, they may be within administration, or they may even be outside your organization. But to enlist the team members you need to help move your adoption process along is really going to be key. Finally, improving outreach, engagement, and training. This goes back to the lack of awareness. This goes back to a number of the barriers, when really we need to make sure that the outreach and the engagement is there, that the follow-up is there, that the team sees the digital technology not as the enemy, not as a change, not as the next thing they have to do, but sees that it can help. It can make life simpler and more productive, and has the help they need as they go along the process of adopting it, because there always will be a little bit of pain during that process of adoption where people find and make their changes. Finally, the last 2 lessons are to share the lessons and keep sharing, and that's something we're working on doing here, about sharing our lessons, but really to be loud about how this has worked, how this has helped, how you can do things more effectively, be more productive, and really make things real for others in your organization. Because if you're not sharing the lessons, then people just see the culture, they just see the barriers, and it feels insurmountable. And finally, enlisting the right expertise. And this is both within and outside your organization, making sure you have the right team in place to really be able to adopt a new technology successfully is going to be critical. So I just wanted to bring us back to the Casper event that happened last week. There are a few key themes that came out of there, and one that I noticed being reiterated in a number of different presentations is this theme of the learning health system. And I thought this was really important when we're talking about being productive and being innovative. We have to learn from the data we're creating and learn from the knowledge we're creating. So it's a cycle of implementing new knowledge that we have built from collecting data, and then using that data, analyzing it, and gathering it, and extrapolating those lessons. And the 2 things I heard about this a lot is, we're not there yet. No one is there yet. We talked to experts who are across the board, across Canada and the United States. They're all trying to implement this type of system. No one feels like they've got it yet. It's a process, it's an iterative process, and it's something that everyone's working towards. The other thing is that the challenge here is implementing that new knowledge. So it reminded me a lot of that first chart we saw with that line going down. People are identifying their problems, they're assessing their processes, they don't have the tools. So we need to lift up that bar, we need to lift up that line and give people the tools to implement this new knowledge. The Hall Laureate lecture was from Robin Tamlin. She was awarded the Hall Laureate recipient for this year, and she was really great. She had lessons that she brought up for researchers, and I think a couple of them really apply here, and I just wanted to bring them back into context. So the first one, which is critical for any digital technology adoption process, persistence is essential. Absolutely. It's true for researchers, it's true for adoption. The second one she stressed was get out of the box, and there are assets all around you. So I talked a number of times today about, looking around your organization, both within and outside your team. Even in the case of digital technology, we would even recommend looking to patients. Lots of people can help you mobilize the activity that you need to adopt a new digital technology. Third is cool questions often come from the health system, and I interpret this in our context really to be that cool ideas come from the health system. So it's the people who are working on the ground with patients who know what their needs are and probably have some really good ideas about how to address them. They should be heard. Finally, opportunities for innovation happen at the interface of disciplines, and it's taking that they should be heard idea and joining them with the people who can actually help them to develop the technologies that they need. And that interface with the two together is where really interesting opportunities will happen. And finally, this is key for this, for everyone, I think, but it takes a team to tackle complex problems. And these are really complex problems, so you definitely need your team in place. The last thing I wanted to leave you with from the Casper conference is this idea of the digitization of healthcare. We know with electronic health records and the amount of data that's being collected in terms of even just X-rays and scans and MRIs, the data needs the data that's being created is huge. The data management needs are immense. And the system is changing. Healthcare is becoming more and more digital, and it will only continue to become more and more digital. So harnessing the power of this data is going to be essential. Being able to weed through the data is going to be essential. And there are already companies like TELUS and Cisco, some of which were there at this conference, who are talking about how they're providing opportunities to help public institutions, patients, and doctors themselves leverage the emerging digital infrastructure. And it's just going to be a very interesting thing to watch, but even more so for the people who are on the ground, it'll be really excellent when you can be a part of it. So that is the entire presentation. I wanted to thank you, and that's it.
So thanks, Sarah. That was a really informative and exciting presentation. We'll hold questions later, and I just want to thank everybody for attending, and I really appreciate it. And we look forward to getting any questions that you might have. Please visit our website, www.neocode.com, or for our dedicated healthcare website, you can visit healthcarebc.neocode.com. Thanks again for attending, and I hope you have a great day. So Sarah, if you just stop recording.
Thank you.
Thank you.
Absolutely. Oh, I stopped sharing.